Dr. Robert Sebbag, good morning.
Good morning.
Thank you to welcome Sanofi Aventis TV. It's a pleasure to be able to meet with you. You are Vice President in charge of access to medicines. First question, would you please be so kind just to describe what it is about, access to medicines?
Okay, when you see a reality about health in the world, you have developed country and developing country and emerging country. It's a big gap between North and South in terms of health, in terms of access to medicine. What we have decided when you see that 70 to 80% of the population have no access to essential drugs. We have technical solution in the North, but why these people have no access to this solution? And we have decided when we can bring a strong added value at Sanofi Aventis to create a full dedicated department to take into account this lack of access to medicine in 7 fields. We have decided to work in 7 fields. Is malaria, it's a very important issue, TB, tuberculosis, sleeping sickness, leishmaniasis, and we wanted also 2 chronic diseases, not communicable diseases, to show that in developing countries, not only communicable diseases, and we have chosen because it's very stigmatization diseases, epilepsy and mental health. And if you take mental health, it's no partner at all. Nobody cares about mental health in developing country. It's not a priority, but it's a reality. And you have the same amount of patients in the North and in the South. And the last one, number 7, is vaccines, because we are number 1 producers of vaccines. And for each one, each field, we try to bring something. For sure, if we have some solution, is a drug. But drug alone is not enough. Drug is only a part of the solution. You have to bring something else, what we call IEC, information, education, and communication. If you take malaria, for example, we have conducted a study in the north of Cameroon with a mother in a very small community, and we have seen that there's no relation, they don't have any relation between mosquito and the disease. How you can fight a disease with only the drugs if you don't destroy the mosquitoes? How you will use a bed nets to sleep if you don't know the relation between mosquito and the disease? It's why information, education, communication is something very, very important. And the number 3, what is important also is research and development. If you take malaria also as an example, the risk of malaria is resistance. It's a long race. It's a long race between the capacity of resistance of parasites and new chemical entities. What is very efficient today, tomorrow will be non-efficient at all. It's why we need new products. And we have decided in our research department to have new compound. And we have an investigation to be ready when we'll have some resistance, 2012, 2013, to have new compounds. And the very important one is also the economical approach. Which price? What we have decided, it's from no profit, no loss, till tiered pricing, according to the income of the population. And what is important is not donation of drug. Donation of drug is very important in case of a big emergency, a tsunami, an earthquake, a war. Okay, you bring drugs. But donation is not a sustainable solution. It's why we need to change the business model. Less profit, more volumes, and to maintain activity in our plants. It's very important to maintain employment. For example, in Morocco, we manufacture all our products against malaria. In South Africa, all our product against TB. In Brazil, all our product. And we scale up the production of this compound. We maintain employment. And it's something very important in terms of sustainable development to maintain employment in developing countries, and transfer of technology is something very important. And we try also not to appear only as a provider of drugs, but as a partner of public health, and to try to bring solution, not only the drug. Drug is a part of the solution. It's why I told you that we have information, education, communication programs.
Do you have some indicators to measure the success of your projects and initiatives?
You have two types of indicators, quantitative and qualitative. Quantitative, if I take malaria, in 2009, our product, AZAC, against malaria, through international organization, we will sell around 20 to 25 million treatments. When I say 25 million treatments, it's 25 million people, children, adults with a malaria crisis. And when you know also that malaria crisis, sometimes you can have deaths, conduct to death. If you take sleeping sickness, our partnership with the WHO, and we are the only partner on this disease, because the only efficient drugs against sleeping sickness is products from Sanofi Aventis. We have treated, within 5 years, 110,000 people. And to treat 110,000 people is to save 110,000 lives. Okay, we are good, not good, but it's a reality. And something very important. We are speaking about lives. This is mainly in terms of quantitative. If you take, for example, mental health, in Morocco, we have a program in some slums around between Casablanca and Rabat in Ben Slimane. The population in 100,000 people, and we know that 1% of the population has chronic psychosis. If you take, the second one is qualitative. I told you, we appear as a partner of public health with health authorities. They don't see you as a big pharma coming here to sell product and take profit. You bring some solutions and you open the door.
This type of department is not that common within the industry. Can you please comment on the importance given by the group Sanofi Aventis to access to medicines?
Sanofi Aventis, we have decided to build a full department, a sort of small business unit. We are 35 people working on these topics, but we use the other department of the company, because we work with the R&D department, we work with the industrial affairs department, with legal department, with many other departments. It's all together. We use really all the know-how of the different departments to conduct this type of policy.
Obviously a very good idea. Thank you very much.
Thank you to you.